Did you know that some common medications might increase your risk of having a heart attack? While these drugs can be effective for treating various conditions, they come with potential side effects that many people are unaware of. Understanding these risks can be vital for safeguarding your heart health. In today's video, we'll uncover 7 common meds that can cause heart attacks. From everyday pain relievers to medications for chronic conditions, it's essential to be informed about what you're putting into your body. If you're concerned about your heart health or just curious about medication safety, you won't want to miss this. Make sure to consult your healthcare provider before making any changes to your medication regimen. Stay tuned for the details, and don't forget to hit that subscribe button for more insightful health tips and information. Let's get started. Number 1. Non-Steroidal Anti-Inflammatory Drugs, NSAIDs. NSAIDs, or non-steroidal anti-inflammatory drugs, are a class of medications widely used to relieve pain, reduce inflammation, and lower fever. They are commonly used to treat conditions like arthritis, muscle pain, headaches, and minor injuries. Some of the most commonly used NSAIDs include ibuprofen, Advil, Motrin, naproxen, Aleve, and aspirin. These medications are readily available over the counter, making them a popular choice for many individuals seeking pain relief. NSAIDs work by inhibiting the production of prostaglandins, chemicals in the body that promote inflammation, pain, and fever. However, they also affect prostaglandins that protect the stomach lining and support platelet function and blood flow regulation. By affecting platelet function and blood vessel dilation, NSAIDs can increase the risk of blood clots, elevate blood pressure, and cause fluid retention. These effects can contribute to a higher risk of heart attack, especially with long-term or high-dose use. Numerous studies have highlighted the potential cardiovascular risks associated with NSAID use. For example, research has shown that high doses of ibuprofen and naproxen can increase the risk of heart attack, particularly in individuals with pre-existing heart conditions. While all NSAIDs carry some risk, certain medications, such as diclofenac, have been found to pose a higher risk of heart attack compared to others like naproxen. It's essential to discuss these risks with your healthcare provider, who can help determine the safest option for your needs. To minimize the risk of heart attack, it's crucial to use NSAIDs at the lowest effective dose for the shortest duration possible. Avoid using multiple NSAIDs simultaneously, and be mindful of the cumulative dose if you're taking over-the-counter medications. Consider alternative pain relief options, such as acetaminophen, Tylenol, which does not carry the same cardiovascular risks. Non-drug approaches like physical therapy, hot-cold therapy, and lifestyle modifications can also help manage pain without the need for NSAIDs. Number 2. Antidepressants. Antidepressants are medications used to treat various mental health conditions, including depression, anxiety disorders, and certain chronic pain conditions. They work by altering the levels of neurotransmitters in the brain, such as serotonin, norepinephrine, and dopamine, which help regulate mood and emotional responses. There are several classes of antidepressants, each with distinct mechanisms of action. The most commonly prescribed include selective serotonin reuptake inhibitors, SSRIs, like fluoxetine, Prozac, and sertraline, Zoloft, serotonin norepinephrine reuptake inhibitors, SNRIs, like venlafaxine, Effexor, and tricyclic antidepressants, TCAs, like amitriptyline. While antidepressants are primarily designed to correct chemical imbalances in the brain, some of them can also affect cardiovascular health. For example, certain antidepressants can increase heart rate and blood pressure or cause changes in heart rhythm, potentially increasing the risk of cardiovascular events. SSRIs and SNRIs. These drugs can increase the risk of bleeding, especially when taken with other medications like NSAIDs or blood thinners, potentially leading to heart complications. TCAs, tricyclic antidepressants, can cause more pronounced cardiovascular side effects, such as orthostatic hypotension, a sudden drop in blood pressure upon standing, arrhythmias, irregular heartbeats, and tachycardia, rapid heart rate. Various studies have examined the link between antidepressant use and heart attack risk. Some research suggests that certain antidepressants, particularly TCAs, may be associated with a higher risk of heart attacks, especially in older adults or those with pre-existing heart conditions. To minimize the risk of heart attack and other cardiovascular issues, it is important to use antidepressants as prescribed and to regularly monitor for side effects. Regular follow-ups with a healthcare provider can help manage any emerging risks. For some individuals, non-pharmacological treatments like cognitive behavioral therapy, CBT, exercise, mindfulness practices, and dietary changes can effectively manage symptoms of depression and anxiety without the cardiovascular risks associated with antidepressants. Number 3. Hormone replacement therapy, HRT. Hormone replacement therapy, HRT, involves supplementing the body with estrogen and progesterone to alleviate symptoms of menopause, such as hot flashes, night sweats, and mood swings. HRT can significantly improve quality of life for many women undergoing menopause. While HRT helps manage menopausal symptoms by balancing hormone levels, it can also impact cardiovascular health. Estrogen can affect blood clotting and the function of blood vessels, potentially increasing the risk of heart attacks and other cardiovascular events. Combined estrogen-progestin therapy, in particular, has been linked to a higher risk of heart attacks, strokes, and blood clots. The risk is more pronounced in older women and those who start HRT several years after menopause begins. Several studies have shown a correlation between HRT use and increased cardiovascular risks. For instance, the Women's Health Initiative (WHI) study found that women taking combined HRT had a higher incidence of heart attacks and strokes compared to those not on HRT. The type, dose, and duration of HRT can influence cardiovascular risk. Women using estrogen-only HRT tend to have a lower risk compared to those on combined estrogen-progestin therapy. However, the risk still exists and must be managed carefully. To minimize cardiovascular risks, HRT should be used at the lowest effective dose for the shortest duration necessary to relieve symptoms. Regular monitoring by a healthcare provider is crucial to assess heart health and adjust treatment as needed. Number 4. Diabetes medications. Diabetes medications are drugs prescribed to manage blood sugar levels in individuals with diabetes. They include a range of oral medications, insulin injections, and other injectable drugs designed to help the body regulate blood glucose effectively. While diabetes medications are essential for controlling blood sugar levels and preventing diabetes-related complications, some of these drugs can have adverse effects on cardiovascular health. Certain medications can influence heart function, blood pressure, and cholesterol levels, potentially increasing the risk of heart attacks. Thiazolidinediones. Medications like rosiglitazone, Avandia, have been associated with an increased risk of heart attacks and other cardiovascular events. These drugs work by increasing insulin sensitivity, but can also cause fluid retention and weight gain, contributing to heart problems. Sulfonylureas. Drugs like glipizide and glyburide can increase the risk of cardiovascular events by causing fluctuations in blood sugar levels and potentially leading to low blood sugar episodes, which can strain the heart. DPP-4 inhibitors. Some studies suggest that drugs like saxagliptin, Onglyza, may be linked to an increased risk of heart failure, although more research is needed to confirm these findings. Several studies have highlighted the cardiovascular risks associated with specific diabetes medications. For instance, the controversy surrounding rosiglitazone led to increased scrutiny and regulatory actions due to its potential to elevate heart attack risk. While some diabetes medications carry higher cardiovascular risks, others, like metformin, have been shown to have a neutral or even beneficial effect on heart health. It is crucial to evaluate the overall risk profile of each medication in the context of the individual patient's health status. To minimize the risk of heart attacks, it is essential to use diabetes medications as prescribed and under the supervision of a healthcare provider. Regular monitoring of heart health, blood pressure, and cholesterol levels can help manage potential risks. Number 5. Chemotherapy drugs. Chemotherapy drugs are powerful medications used to treat cancer by killing rapidly dividing cells. These drugs can be administered orally, intravenously, or through other methods, depending on the type and stage of cancer being treated. While chemotherapy drugs are essential for treating various cancers, they can also have significant side effects on the cardiovascular system. Some chemotherapy agents can damage heart muscle cells, affect blood flow, and disrupt the normal function of the heart. Anthracyclines, drugs like doxorubicin, adriamycin, and daunorubicin are known for their effectiveness against certain cancers but also for their cardiotoxicity. They can cause heart muscle damage, leading to conditions such as HER2 inhibitors. Trastuzumab, Herceptin, is used to treat HER2-positive breast cancer but can lead to heart problems, particularly when used in combination with anthracyclines. Fluoropyrimidines, medications such as 5-fluorouracil, 5-FU, and capecitabine can cause chest pain and coronary artery spasms, increasing the risk of heart attacks. VEGF inhibitors. Drugs like bevacizumab, Avastin, can cause hypertension and increase the risk of blood clots, which can lead to heart attacks and strokes. Numerous studies have documented the cardiotoxic effects of various chemotherapy drugs. For example, research on anthracyclines has consistently shown a dose-dependent increase in the risk of heart failure and other cardiovascular events. The cardiovascular risks associated with chemotherapy drugs can vary significantly depending on the specific agent, dosage, and individual patient factors. For instance, patients with pre-existing heart conditions or those receiving higher cumulative doses are at greater risk of experiencing adverse cardiac events. To minimize the cardiovascular risks of chemotherapy, it is essential to have a comprehensive treatment plan that includes regular monitoring of heart function. Baseline and periodic assessments using echocardiograms or other imaging techniques can help detect early signs of cardiotoxicity. Dose adjustments and the use of cardioprotective agents such as dexrazoxane can help reduce the risk of heart damage, especially in patients receiving anthracyclines. When possible, less cardiotoxic chemotherapy agents or alternative treatment modalities, such as targeted therapy or immunotherapy, may be considered to reduce the risk of cardiovascular side effects. Supportive care, including medications to manage hypertension and lifestyle interventions to improve heart health, can also play a crucial role in minimizing risks. Understanding the potential cardiovascular risks of common medications is essential for maintaining heart health. From NSAIDs and antidepressants to HRT and chemotherapy drugs, being informed about these risks can help you make safer choices and engage in meaningful discussions with your healthcare provider. Always consult your doctor before making any changes to your medication regimen. Stay proactive about your health by monitoring any side effects and considering alternative treatments when necessary. Thank you for joining us on this important topic. For more health tips, insights on medication safety, and updates on managing your well-being, be sure to subscribe to our channel. Hit the subscribe button and turn on notifications so you never miss out on our latest videos. Stay informed, stay healthy.